Good morning. I'm Molty Thomas, staff nurse at DPRC. Today I am going to talk about pain assessment. So the objectives are definition of pain, nature, basic types of pain, classification, pain descriptors, and assessment of pain. What is the definition of pain? The International Association for the Study of Pain defines pain as a sensory and emotional experience associated with tissue damage or described in terms of such damage. Pain is also known as the fifth vital sign. Identifying pain as the fifth vital sign suggests that the assessment of pain should be as automatic as taking a client's BP and pulse. What is the nature of pain? Pain is subjective and highly individualized. Stimulus can be physical and or mental in the nature. It interferes with personal relationships and influences the meaning of life. Only the patient knows whether pain is present and how the experience feels. Pain can Pain may not be directly proportional to amount of tissue injury. There are mainly three basic types of pain. First is nociceptive pain. What is nociceptive pain? Nociceptive pain is the body's natural defense against harmful surfaces or actions. This is the type of pain everyone is most familiar with. Everything from bee stings, burns, repetitive strain injury, tumors, and inflammatory arthritis. Nociceptive pain typically changes with movement, position, and load. Next is neuropathic pain. This is it is the result of damage to the nervous system and is often chronic. Unlike nociceptive pain, neuropathic pain does not need to develop in response to any outside stimulus. It's just mixed pain. This pain is caused by a mixture of nociceptive and neuropathic factors. An initial nervous system dysfunction or injury may trigger the release of inflammatory mediators, resulting in a subsequent neuropathic inflammation, causing the quality of pain to change to burning, throbbing, to tingling type of pain. Examples of mixed pain include migraine, headaches, and myofascial pain. Next is the classification of pain. Pain is classified as based on duration, that is acute and chronic, based of based on location, for example, like headache, back, joint pain, stomach pain, cardiac pain, like that. Based on intensity, that is mild pain, moderate pain, and severe pain. Based on etiology, for example, nociceptive and neuropathic. So based on duration, pain is classified as acute and chronic pain. What is acute pain? Acute pain usually comes on suddenly and is caused by something specific. Acute pain usually doesn't last longer than 6 months. The pain usually becomes less severe as the injury begins to heal. So, what is a chronic pain? Chronic pain is a condition wherein the body constantly sends pain signals to the brain even when the injury has healed. This pain lasts longer than 6 months. The pain persists even after the injury heals. So, these are the characteristics for acute and chronic. Now we will see mild, moderate, and severe pain. So this pain is classified according to the severity, intensity. So in the mild pain, the pain doesn't interfere with your regular activities. The pain score is usually in between 1 to 3. In this kind of pain, you may notice the pain, but you can tolerate it. You may feel some twinges of pain. You may barely notice the pain. So these are the characters under mild pain. And when we move to moderate pain, in this, pain may interfere with your regular activities. So the pain score is like 4 to 6. Pain makes it hard to concentrate. And in this, you can't ignore the pain, but you can still work through some activities. And next point is you can ignore the pain at times. So these are the characters under moderate pain. And while it is severe, pain keeps you from doing your regular activities. Like, for example, pain is so bad, but you can't do any of your regular activities, including talking or sleeping. Pain is so intense that you have trouble talking. Pain distracts you and limits your ability to sleep. So while all these things occur, we can come to we can say it's severe, and the pain score is 7 to 9. And when it is 10, that is the worst pain you can imagine. So pain is classified as nociceptive and neuropathic under etiology. First is nociceptive. Nociceptive is again classified as two, like visceral and somatic. Visceral is again classified as two, like vascular and other. Examples for vascular pain are migraine, dissecting aneurysm, and ischemia. Under other pain, it's coming from pancreatitis, cardiac ischemia, peritoneal inflammation. The somatic pain is classified under musculoskeletal, and it is pain origin from tendon, bursa, ligament, and fascia. Neuropathic pain is classified into two, pain origin from central nervous system and peripheral nervous system. Under central nervous system, the pain example for pain is the post-stroke pain, spinal cord injury, multiple sclerosis, and all. Under peripheral nervous system, it is examples are diabetic neuropathy, post-therapeutic neuralgia, trigeminal neuralgia. Now we'll see the somatic pain and visceral pain. So, somatic pain, it can be superficial or deep, like joints, tendons, bones. Nociceptors are involved in this somatic pain, often well localized and usually described as throbbing or aching. What is visceral pain? It involves hollow organ and smooth muscle nociceptors that are sensitive to stretching, hypoxia, and inflammation. Pain is usually referred poor localized, vague, and diffuse. May be associated with autonomic symptoms like pallor, sweating, nausea, blood pressure, and heart rate changes. Now we will move to the pain descriptors. Each person experiences pain differently. Describing pain accurately is important, and as it can help doctor make the right diagnosis and develop the best treatment plan. The following are examples of words that can help to describe the way of pain feels. So under the vascular pain, the pain descriptors are throbbing, pounding, pulsing, beating, and cold. Under neurogenic, the pain descriptors are sharp, shooting, burning, hot, searing, itchy, stinging, pulling, jumping, electrical, gnawing, pricking, etc. Under the somatic, they are aching, sore, heavy, hurting, deep, cramping, dull. So under the emotional kind of pain, the pain descriptors are agonizing, nauseating, frightful, piercing, dreadful, punishing, exhausting, killing, unbearable, annoying, cruel, torture, etc. Now we will move to the important part of this presentation, that is the assessment of pain. Assessment of pain includes subjective and objective. So while doing the subjective assessment, the most important part is taking pain history. While taking pain history, nurse must provide an opportunity for clients to express in their own words how they view it and their situation. This will help the nurse to understand means of pain to client and how the client is coping with it. So while taking pain history, make sure we collect all these 8 important points. We can easily remember through O, P, Q, R, S, T, U, V. So in the O, like onset, and these all questions we can ask to the patients while collecting the pain history, like when did it begin, whether it was abrupt or sudden, how long does it last. By taking provoking or palliating pain history, we can ask like what brings the pain, what makes it better, what makes it worse. For checking the quality of the pain, you can ask what does it feel like, is whether it was stabbing or throbbing, or we can ask the patient to describe it. For taking history of the region or radiation, we can ask like where is the pain, or where does it spread, whether it's radiating, or does it follow a pattern. These questions we can ask. For the severity, what is the intensity at best, how much the score at worst, average pain, what other symptoms, like that questions. For the treatment, we can ask the patient, what have you used, what are you currently using, which tablets, how effective, was there any side effects, like these questions. For understanding the impact, we can ask like how is the pain affecting them, how was it affected their life, like that questions. And for collecting the values of the patient, We can ask them what are your goals and what is an acceptable pain level. So please remember to ask all these questions while taking the pain history. Now we will move to the pain scale. A pain scale is a chart that represents different levels of pain, from mild to severe. People can use pain scales to help them describe how much pain they are feeling. Most common used scales are numerical scale, Wong-Becker scale, and visual analog scale. In DPRC, we use visual analog scale for adults and Wong-Becker scale for the pediatrics. First one we will see the visual analog scale. The visual analog scale is a tool widely used to measure pain. It is useful in assessing the intensity of pain. It includes a horizontal 10 centimeter line which anchors indicating the extremes of pain. The client is asked to place a mark indicating where the current pain lies on the line by showing this diagram. This is then measured in millimeter from the left angle, that is no pain, to generate a pain score. So the left is marked as none or no pain, and the right is marked as severe or worst possible pain. Next is Wong-Becker scale. The Wong-Becker faces pain scale combines pictures and numbers for pain ratings. It can in DPRC it is used for children. Next part is the collecting objective data. So for collecting the objective data, we have to assess the non-verbal responses of the patient to the pain. So we can assess the facial expression, vocalization like moaning and groaning or crying and screaming, immobilization of the body or body part, purposeless body movements, behavioral changes such as confusion and restlessness, rhythmic body movements or rubbing. So while all assessing all these responses, non-verbal responses, we can collect the objective history. So this is the visual analog pain scale assessment that we are doing in the Salama. So while knowing all these points which we discussed in this presentation, we can easily fill this fill this pain scale. Hope you all understood my presentation. Thank you.